My name is Halima Komhanj. I'm going to take you through family planning. Family planning is all about helping couples and individuals to choose proper ways of child spacing and the number of children that they intend to have. Specifically, we shall look at the terms that are commonly used when we are talking about family planning, and then we'll look at contraceptive methods. There are different types of contraceptive methods. So for each type, we shall look at the advantages and the disadvantages, and then we shall also look at the side effects of each type, and then we look at the effectiveness of each type, and then we have a summary. This is a brief summary of the methods, and we are showing that the male and female condoms are they have 12% failure rate. When you look at the spermicides, they have 21% failure rate. So these condoms, when used safely and well, they actually offer 97% against unwanted pregnancy. Family planning is a strategy or a program that enables couples and individuals to be able to do the following. One, they should be able to decide freely and responsibly on the number of children that they want to have, and then the spacing for those children. And this decision is normally based on information that is accurate, and the method should also be accessible. A different range of methods that we are going to look at. So when we talk about contraceptive refers to a drug or a device that is used to prevent pregnancy. So we have different methods or different types of contraceptive methods, and we are going to start by demonstrating one of them, which is a male condom, and that is the most commonly used contraceptive method. But before we demonstrate use of a condom, let's first have a classification of the different contraceptive methods available. Each method is named according to what it does. So there are barrier methods, where condoms lie. Then we have the intrauterine methods, and then we also have the hormonal methods. We have the surgical, which are permanent methods. We have the natural methods. We have what we call emergency contraceptive methods. And then lastly, we have the traditional methods. So we are going to start with the male condom, which is the most commonly used contraceptive method, and it is a type of a barrier method. As I talk to you about the male condom, my colleague will come over and do some demonstration of how to use the male condom. What is important is that you must know that the condom is the only barrier method that prevents pregnancy and at the same time protects one from getting sexually transmitted infections, including HIV. So, how does it work? A condom works by preventing fertilization. So it does not enable the sperm to meet the egg, so fertilization cannot take place, therefore one cannot get pregnant. How is it used? One, you must get a condom from a reliable resource or reliable source. When we talk about reliable source, it means you will be getting it from either a pharmacy or you're getting it from a health facility. Two, you must make sure that you check if the condom is still okay. My colleague, please come and do a small demonstration. So you check if the condom is still okay. And when you say the condom is still okay, it means that you're checking the expiry date. When you buy a condom from a pharmacy or you get it from a health facility, look at the packet. The packet should be able to have an expiry date. And then you also check carefully that it is not open. So it should not be open. So that's one of the types that we are going to use to demonstrate. There are different types. They come with different scents, different names, different brands. So it depends on what you need. So when you look at the expiry date, then after that you squeeze. that you have to open it carefully to ensure that, first check it to make sure that there is no air, because if you feel that it's not hard or it is soft, then it means that there is air, there will be some holes in, then you cannot use it. So you ensure that you can only use it when the pen is full, erect. So you squeeze it. Once you've opened it, make sure that as you're tearing it, getting it from its packet, you have to tear it carefully to ensure that you don't damage the inner part. Once you do that, make sure at this point in time when you're opening already the penis is fully erect. So what you do now, you're going to squeeze the tip of the condom. You squeeze the tip of the condom and then you put it at the end of the penis. So what you're seeing here is our fully erect penis, and this is the condom. So you're holding the tip of the condom and then you put it on to the end of the penis. While you're still holding the tip, you have to unroll the condom down to the base of the penis. So once that is complete, then you're ready for sexual intercourse. And after that, after ejaculation, you hold the ring. That's the ring. This is the ring of the condom. So after ejaculation, you hold the ring and then you withdraw. You withdraw the penis from your partner. You withdraw the penis from the partner. And then you ensure that you roll it, you unroll it carefully and eject. You could wrap it in a toilet paper or anywhere and then you dispose. So this is one of the most commonly used method for preventing unwanted pregnancy and also protecting one against STIs. So you make sure that you discard it. It should never be used again. For every round, you must be able to use a new set of condoms. So thank you very much. The advantages of using a male condom, like we have said, it not only protects you from unwanted pregnancy, but it protects you from sexually transmitted infections, and it is not expensive. You can be able to get it without a prescription from any nearby pharmacy, and it can also help to relieve premature ejaculation, and then it can also help one to stay erect longer. You stay erect for a longer time, and then the other thing is that you can use it with also other methods of contraception. The disadvantage with condoms is that some people are allergic to latex, so they can get skin irritation. There are also different brands, so if you find that one reacts, you could try another one. The other disadvantage, of course, is that some people don't have the confidence to probably go and maybe purchase, but otherwise condoms are very effective. When we talk about their effectiveness, it's up to 97%. So that is one of them. Now we go to, this is the demonstration that my friend was trying to show you. We can move on to see the female condom. The female condom is used by female, and it also prevents one from getting STIs, and it can also prevent one from getting unwanted pregnancies. So how it is used is that for it is inserted in the vagina before sexual intercourse, and then you have to ensure that the ring is inserted, the ring stays outside when it is inserted in the vagina. The disadvantage with these female condoms is that they are not readily available, and they are a bit expensive compared to the male condom. For it is that you can put it on earlier, even before sexual intercourse, unlike for the male one, and it has been known to protect from certain cancers like cervical cancer. When we come to the disadvantages, sometimes it's tricky to use for the first time. It can get a little uncomfortable, and then sometimes it can actually slip off during the process, and then, like you said, it's not available in all clinics. Then the side effects, almost none, except for people who are allergic to latex. It will cause some sensitivity. So the female condom, like I said, is not commonly used. Most women find it uncomfortable. They be anxious while using it, but it is actually available, and it also protects one from getting unwanted pregnancy, and also protects one from getting sexually transmitted infections, including STIs. As you see how it looks like, it is in a wrapper. You need to also look at it to look at the expiry dates, and then you tear it well. It comes with its applicator that is used to push through the vagina, and this is how it looks like. You must push it as far as it can actually go. So we go to another type of barrier method. The other type of barrier method that we have is what we call the diaphragm, or we have a cervical cup. It's a shallow rubber cup, and how it works, it also it acts as a barrier and prevents the sperm from moving forward. All right, so we have so far seen two types of barrier methods. We saw the male condom and then the female condom. So now we are going to look at the diaphragm or the cervical cup. The cervical cup is a shallow rubber cup, and how it works is that it prevents the sperm from mixing with the mucus in the cervix, which is called the cervical mucus, and that means that the sperm cannot enter the cervical canal, therefore the sperm cannot meet the egg, therefore fertilization does not take place. So how do you use it? You need a trained health worker to be able to demonstrate to the client how to use it. Once it has been demonstrated, a female can be able to insert it through the vagina before having sexual intercourse. Most importantly, it must remain in the place for at least 6 hours and not more than 24 hours after sexual intercourse. So after use, you wash it gently with soap and then you keep it. Like we said, the condoms are disposable and you only use them once, but for the cervical cup or diaphragm, you can actually reuse it, but only after you have washed it with soap, dried it, and kept it in a safe, cool place. So the advantages of the cervical cup is that it is of low cost, and it's of low cost, it's readily available, and it also offers protection against unwanted pregnancy. Unfortunately, one of its disadvantages is that it cannot protect one from certain STIs. However, it has been known to be 92 to 96% effective. When it comes to its side effects, it also causes irritations to the vagina. What people must know is that not all women experience these side effects. So some, it can cause irritations when they are allergic to rubber, but for those that are not, it may not cause irritations. So some studies show that actually it can protect women from getting certain cancers like cervical cancer. Yeah, and it can also protect them from getting certain STIs like gonorrhea, chlamydia, and so on. So those are the disadvantages, the advantages of a cervical cup. And that's how it looks like. Unfortunately, we don't have it here to show, but they are available in health facilities. You can be able to find. That's how it looks like. All you need is to wash it gently after every intercourse, and then you keep it and use it for the next time. So we go to another barrier method, which is the spermicides. So the spermicides, they are some form of tablets or cream or jelly. There are different categories of spermicides that are available, and they are also barriers. What we need to know is that every barrier method prevents fertilization. When fertilization does not take place, then one cannot actually become pregnant. So how they work, they are inserted into the vagina before sexual intercourse, and after every act you need to insert more for the next act. One should not wash the vagina for at least 6 hours after sexual intercourse. So when you use spermicides, you make sure that you insert it before sexual intercourse, and it has to be there for at least 6 hours even after you have finished, and if for any other you must again insert. One of the advantages is that it is readily available, and you can actually get it from a pharmacy without prescription. The disadvantage is that you cannot use it many times, and you must use it before each. So that means that for every act you will have to actually apply more. So that can be a little inconveniencing for some females. And then it's that sometimes it can cause leakage and soil the place. But in terms of effectiveness, it is known to be 79% effective in terms of preventing unwanted pregnancy. So this is a demonstration of how spermicides are used. You just insert it before sex. You can even put it 1 hour even before the act. And then you need to have the applicator, or you can use your fingers. You just need to have a comfortable, like a chair, like how the lady is standing, and then you put one leg on the chair, and then you make sure that you use the applicator with the spermicide to push it as far as it can go. And then don't wash the vagina for at least 6 hours after sex. It has to stay there. And if possible, you always keep them in cool and a dry place. So that is a little demonstration of how you can actually combine both a spermicide together with the cervical cap. You can pick the cervical cap, which just looks like a plastic rubber. You pour the spermicide in, and then you fold it properly. Get a comfortable position where you have access to your vagina, and then you push as far as it can actually go. So that is how spermicides look like. They are of different types and different brands, and they are available in pharmacies. So we go to another type. This is now the second type. We are done with the barrier methods, and as we have seen, barrier methods, we have talked about condoms, both female and male. We have talked about the cervical cap or diaphragm, and then now we are moving on. We have also talked about spermicides. Now we are moving on to another type, which is called the intrauterine method. The intrauterine method, we have the IUD, which is the intrauterine device. From its name, you see this one goes direct to the uterus. It's a T-shape, and it is made of, it has a copper wire. This is how it looks like. Let me just get someone to open, and then I demonstrate. So the copper T wire, like we said, is about 3 centimeters long. We are going to look at it, and it is generally coated with a copper wire. So it's the metallic ions in that, thank you. The metallic ions, what they do is that they kill the sperm. They kill the sperm, and then they do not also allow fertilization to take place. So this is how it looks like. It has strings. It's of T-shape, like you see, and the goldish part is the copper. So when it's pushed into the uterus, it must be in this T-shape. and it can only be applied by a trained health worker. A person should not try out, no females should actually try to insert this themselves. So it comes with its applicator, where the strings are actually placed in here. And then pushed. So once it's pushed up to the uterus, then it's removed. They use this to pull it off, and then this gets stuck in the uterus. So it has to be like this, with the strings actually hanging below the uterus. So what does it do? It kills the sperm. So in this copper, there are some copper ions, and they are the ones that are responsible for killing the sperm, so they can never allow fertilization to actually take place. So the sperms will not be able to actually swim and meet the egg. The doctor or a health worker trained like a nurse, they can be the only ones that can actually do that. And this process of inserting actually takes less than 5 minutes. The advantages is that, of course, this is reversible. Anytime you want to have children and you remove it, fertility can always come back immediately once it is stopped. And the advantage of this is that it can even stay up to 5 years if there is no side effect obtained. So it can give you protection against having unwanted pregnancy for even 5 years, so it takes longer. When it comes to the disadvantages, it could alter menstruation, it can cause mild pain, it can actually cause increased periods. Sometimes people will have periods for longer, others will have shorter periods. It can also make somebody gain weight, and like I said, these disadvantages or side effects are not applicable to every woman. So as some gain weight, some might actually lose weight. As some probably get nausea, others may not actually get. And an IUD has been known to be one of the effective methods. It's up to 97% effective if it is correctly inserted. And that's how it looks like. Yeah. So we go to another type. So now we have so far seen 2 types of contraceptive methods. That's the barrier methods, the intrauterine. Now the third one is what we call the hormonal methods. The hormonal methods come in different types. One of them is that we have the contraceptive pills, and I have an example here of a contraceptive pill. They come in different types. They come in different types, so we are going to see how some types look like. What do? They have hormones. So these tablets or these pills, so we have the third type, which is the hormonal method. The hormonal methods, one, we have the contraceptive pills. These pills, they contain hormones, and these hormones, they alter the woman's system, and she's actually not able to get pregnant. So we shall look at the other types in details. How do they work? They suppress the egg and make it difficult for implantation to actually take place. You need to make sure that you visit the health worker at least once in a year to be checked when you are on these pills to ensure that they are effective. Like this one is important for women who have the 21 days cycle. Some women have 28 days cycle. So this is very effective for those that have a 21 days cycle. So you take each pill every day for the 21 days, and then you only skip the 7 days where you are supposed to be taking the one that actually has the iron. So you will see the way they are. These ones are the ones that have iron, and then these ones actually don't, which you take for 21 days. And they can be able to protect one from getting unwanted pregnancy. They are readily available. And the other advantage is that they don't interfere with sex. Somebody doesn't have to be under tension that something is inside, it's going to get out. The disadvantage is that you have to take it daily. So for persons who might forget to take a pill, they can actually get pregnant. What you need to know is that if somebody has actually skipped, they should always remember to take. And sometimes you are also advised to take it with any other method, since they do not protect you from getting STIs. They are effective at preventing unwanted pregnancy, but they cannot protect one from getting sexually transmitted infections. So for you to achieve that, it can actually be used in combination with a condom. In terms of its side effects, it can cause also irregular bleeding, can cause nausea, can cause headaches, can cause tenderness of the breasts, and can also cause menstrual cramps. Some people, their menstrual cycles can actually change. You can bleed in between the periods, but like we said, not all these side effects occur to every woman, and not all of them. Some may actually not have them. And if used well, pills are very effective. They can give you 99.9% protection against getting unwanted pregnancy. And these are the different types. I was able to get for you this, but you can actually find the different types available in pharmacies. You also can get it without getting a prescription. So the other type is the injectable. So the injectable is also a hormonal method. Like I said, every type is named according to what they do. So the hormonal methods, they have hormones in them, and these hormones, they can be progesterone, others can be estrogen. So these, they alter the system of the lady, and she's not able to actually conceive. So one example for the injectable that I have, we have this, and also these ones, the disadvantage is that you need a health worker to do that. So there are some methods which are easily used by the female themselves, and then there are those that you actually need to go to the health worker, and this is one of them. So what happens is that the hormones, they prevent pregnancy because they change the woman's body, similar like what the pills that do. They also alter the system, and then you cannot be able to get pregnant. How it is used is that this injection is given every 2 to 3 months. So when you get your shot after 3 months, it means that in that period of 3 months, you can have sexual intercourse without actually getting pregnant. And it can either be given on the upper arm, or it can be given on the buttocks, depending on the type that you have. So one of the advantages we looked at is that you don't need to worry about using it all the time, because once you use it for the next 3 months, it's given you that protection. And then you can use it still even when you're breastfeeding, and some studies have shown that it can also help prevent cancer of the uterus. And it is also a reversible form, meaning that at any time when you want to get pregnant and then you stop it, fertility can actually return. So the disadvantages is that for people who are afraid of getting shots, this may not be a very good option for them. The other side effects are the same like for the pills: irregular menstruation, breast tenderness, headache, nausea, vomiting, which we said are not common to every woman. Some may actually have changes in the body weight and all that. And it is 99.7% effective. So like we have seen, hormonal methods, they have more side effects, but in terms of effectiveness, they also give the greatest percentage of effectiveness. And this is an example of an injectable form. This is also an example of the site where it can actually be injected. So we can move on again and look at another method of hormonal methods, which is the implant. The implant is small. They come in thin rods, and they are plastic. And what do they contain? They contain a hormone that is called progesterone. So this hormone, when it is in the body, it slowly
releases those hormones, and then they alter the woman's system, and then they are not actually able to get pregnant. So what you need to know is that we have the condom preventing one from getting STIs. This does not prevent you from getting STIs. So if you want to protect yourself from getting sexually transmitted diseases, you can use this in combination with a condom. So the advantages is that once it is removed, so they are placed and there are 6 of them, but once you remove them, fertility returns easily, and they are available, they are long lasting, they can offer up to 7 years of protection once you have them in your body. However, they are not effective for women who are almost 70 kilograms and above. So they are very effective for women that are below 70 kilograms. And then the other thing we need to know is that they don't offer protection against STIs, like I mentioned. The side effects, they cause longer and heavier menstrual flows, and then they can also cause inbleeding between the periods. Like you have finished this period, before the next you can actually get bleeding in between. In terms of effectiveness, they are 99.9% effective when used the way they are supposed to be used. And that's how they look like. It's just a rod that looks like this. So you have to have 6 rods inserted here, and this is also done by a trained health worker. And then in terms of how they look like, this is the procedure of how they are inserted, and like I said, they are long lasting, because when inserted well, without any complication, a woman can take up to 7 years before they are actually changed, and once they're removed, fertility returns back immediately. We go to another type of hormonal method, which is the control patch. Not so common, but available. So this is just a thin 5-centimeter patch, and it also has both hormones, estrogen and progestin, which are inserted into the bloodstream, and they will prevent unwanted pregnancy. They are worn on the woman's, you can put it on the abdomen, it can go on the upper arm, it can go on the buttocks. So you can put it for like a week, and it can be used 3 times or consecutively for 3 weeks. You can also even put it on while swimming. So this is one of the most comfortable methods, but not readily available. So you can only get it through the health care professional. The disadvantage is that it cannot protect you against STIs. Its side effect is that it has similar side effects like for all hormones: breast tenderness, change of the menstrual cycle, nausea, headache, vomiting, and all that. And when used correctly, it gives you up to 99% effectiveness. So this is how it looks like. It's just a patch, like you see, a patch. You can insert it on this side of the thigh, the upper thigh. You can also insert it on the side of the buttocks, like how it is demonstrated here. It can also go on the shoulder up or in front. So it has very many places where it can be placed, and it also protects. So the 4th type is what we call the permanent methods. Now, the permanent methods are irreversible. Once you have used that, you cannot go back and alter that you want children. They are not encouraged for persons that are young with the intentions of wanting to have children in the future. For male, we talk about vasectomy, and then for the female, we talk about tubal ligation. So what happens with the male is that the vas deferens tubes are cut. When those tubes are cut, that means that the sperms can no longer swim to meet the eggs, so there will never be any conception. And for the female, they still cut off the fallopian tubes. So the other methods are the permanent methods. The permanent methods are 99% effective. We have vasectomy for the men and tubal ligation for the female. And what happens here is that once the tubes are cut, the vas different for the men, and then the fallopian tubes for the female, then we do not expect fertilization to even occur, or we do not expect the females to release any eggs because they pass through the fallopian tube. So you're 99% sure that you will never be pregnant. The disadvantage is that it is irreversible. Once you've done it, that is it. You cannot have children. So it is not recommended for young couples. Then we go to another method, which is the natural methods. Among the natural methods, we have one of the safest and very effective, which is abstinence, that offers 100% effectiveness. And what happens with abstinence is that there are no side effects of abstaining. When it comes to the lactational amenorrhea method, this is recommended for mothers that have children below 6 years. When you are doing exclusive breastfeeding and you're doing it at least every 10 times daily, you are not likely to get pregnant, because during breastfeeding, there are hormones that actually don't allow pregnancy to occur. So it is also very safe. The cervical mucus is that the lady has to keep on using her finger to touch the vaginal mucus, and during ovulation, the mucus is kind of slippery. So during that time, the woman makes sure that they do not have sexual intercourse, because during that time, ovulation is taking place. So that means if you have intercourse during that time, you can actually become pregnant. So it might be uncomfortable for women to insert their fingers and notice the difference between the mucus of the vagina during ovulation and when it is not ovulation. So the other natural method that we can look at, take us back up. The other method, which is natural, is the basal body temperature method, where you have to keep on taking your body temperature. During ovulation, the temperature of the body raises a little higher, like 0.2 degrees to 0.4. So when you notice any increase in temperature, then you know that you are ovulating, and then you try as much as possible to avoid having intercourse during that time. Then we go to the other methods, which is the emergency oral contraceptives. So these are birth control patches that should be taken within the first 72 hours of sexual intercourse. They can be able to prevent implantation from taking place, and you're sure that the lady will not be able to actually become pregnant. They are readily reliable, but it's not a method that should be used routinely. If you're taking, like, for example, contraceptive pills, and you have missed taking a pill, then you can actually use the emergency just for that protection within the 72 hours. They cause the same side effects like the ones for pills, where we talked about menstrual pains, irregular bleedings, headache, nausea, vomiting, and they offer up to 95% effectiveness. Then the traditional methods have not been scientifically proven to work, but in some African countries, they actually use them. So scientifically, we do not know that these methods are effective, the traditional ones, and health workers do not recommend for them to be used. So we have things like using charms, like trying to tie strings and omelettes around the person's waist. Some people use cow dung or zebra dung, and then some people drink herbs made out of leaves and roots. Others eat certain fruits or take holy water, and then others say after sexual intercourse they are jumping up and down. So we do not encourage this. So this is a brief summary of the methods, and we are showing that the male and female condoms they have 12% failure rate. When you look at the spermicides, they have 21% failure rate. The diaphragm and the cervical cap, they have up to 18% failure rate and 0.3 respectively. In terms of the pills have 1% failure rate, especially those that have the progesterone hormone. The ones that have the estrogen, together with the progesterone, they have 0.3%
failure rate. We move on, we see that the ones that are no plants and injectables, they have 0.3% and 0.09% failure rate, respectively. Then for the permanent methods, which we talked about, vasectomy and tube ligation, we have 0.15% and 0.4% respectively in terms of failure rate. Abstinence, 0 failure rate, you are sure you will not get pregnant. Natural methods, the failure rate is 20%. Traditional methods, never documented and not encouraged.
So I've been Comhanje Halima taking you through family planning methods, and I hope at the end of this session you're able to describe the different types of family planning methods available and recommend some that you think are very effective to women of the reproductive age group. Thank you.